Welcome back to Better Pet Parents. Today we're going to be talking about common mistakes that pet parents make in the event of medical situations arising unexpectedly. And for the sake of today's conversation, we're not talking about really serious emergency situations. We're talking about more like common things that might happen, like ear infections popping up, upset tummies popping up, or minor little scrapes and injuries and that kind of thing. So sometimes one of the things that I see my clients do in situations like this, and the general public really, is people tend to make the first mistake, which is getting on the internet and self-diagnosing what they should do, what a problem is, what it means, and that kind of thing. We are guilty of doing this for ourselves instead of consulting our doctors, and pet parents are certainly guilty of doing this also when it comes to things that pop up with their pets. And so I would say that the most common mistake people are making is getting on the internet when things come up and making decisions about how to treat a minor problem because of something that they read on the internet that may not be true for their pet's unique case. It's also very important to remember that when we're talking about looking things up on the internet, first of all, they may or may not be true for your animal's case. But second of all, your pet taking the medications that your pet takes, you need to keep in mind that if you ever do anything, you don't know unless you talk with your pet's veterinarian if there's going to be interactions with anything that they're currently on, including any supplements that they take or preventatives that they take for flea, tick, or heartworm. So it's very important not to give your pet anything without talking to their doctor. Because when we get on the internet, we can make mistakes about what we're even treating, what something is, and if there's going to be any potential interactions. People can also commonly make dosing mistakes when it comes to, self-treating like that. Another mistake that I think that people are really guilty of making is getting on community groups. So we have nothing against things like Facebook groups or community groups, because we at Better Pet Parents have an exclusive Facebook group for our community here for like-minded pet parents to get together and talk about pet parenting. But one of the things that we stress in our own community is that we're not veterinarians. And so we don't want anybody going into that group and looking at a picture of someone else's pet and saying, oh, that's this, or you should do this. Because we really preach within our community that you need to talk to your doctor about any medical decisions or anything that you're ever administering to your pet for the same reasons that we just talked about previously. So I just want to caution everybody about asking for other people's opinions in groups. So there's going to be, it's very common for there to be groups about pet parents who have animals that share the same diagnosis. For example, animals that have diabetes, animals that have Cushing's disease, animals that are in kidney failure, things like that. And so it's very common for people who all have animals with the same problem to get together and share moral support in groups like that, and they're very good for that. But I think that people, get on there and sometimes, will ask a question about their pet's case. And maybe people who are trying to be helpful will say, oh, you should do this or that because that's what they needed to do for their pet's case. And that might not be right for someone else's, even though those two animals share a common diagnosis. And it's just very important, guys, to keep these kinds of things in mind when you're making decisions at home about what to do about problems that arise with your pets, because the internet may or may not be correct with whatever you're researching, and the groups that you're in may or may not be correct for your pet's unique needs. And one of the things that I think that people really need to keep in mind, and this is really the reason why I'm making this video today, is that I know that like with a lot of my clients, they'll say things like, this weekend my dog got a really upset tummy. and I didn't want to pay a vet bill, so I did nothing. Or they'll say, oh, that ear infection returned, and I didn't want to pay a vet bill, so I did nothing. So one of the things that I want to caution against today is always assuming that there's going to be a vet bill. I want to remind people that if you have an established relationship with a veterinarian, you can always call that veterinarian during their business hours, and you can say, hey, you know that we're always treating this ear infection. Is there any way that I can come by and get a refill of the meds without an office visit? You know, depending on how long it's been since you've been in, your vet may or may not say whether that's possible, but you can always ask. I think that people forget that the established relationship that they have with their local veterinary clinic or whatever veterinary clinic that they're using, and the client, patient, and doctor relationship that they have with their veterinarians is there for a reason. That's there to be utilized by you throughout your pet's lifetime for whatever needs may arise. So, you know, you're going to go in and talk with your veterinarian for annual exams and the regular things. But don't be afraid to call them if something minor pops up like that and say, hey, is there anything that you can tell me that I can go to the drugstore and get to treat this that's over the counter? And if so, how much, and things like that. And sometimes they can tell you to go and get something that might cost you $10, and then your pet has some relief over the weekend or whatever the situation is. So, you know, obviously we're always talking about different things here at Better Pet Parents, and seriousness of the situation is going to vary with all kinds of different cases. And I'm not saying that, you know, we don't understand that in emergency situations that's not going to cut it. But I am just telling people that when minor things happen, don't just always assume that you have to pay a vet bill and instead saying, well, then I'm going to do nothing, because you can always use that telephone, guys. You know, you never know if just a quick call to your vet and a quick conversation with someone who knows the drugs that your pet is taking, who knows your pet's accurate weight, who can advise you more accurately than anybody on the internet can, could help you in a situation like that, where maybe you don't need to go as far as a vet visit, and certainly you don't need to make avoidable mistakes with self-diagnosing the situation. I just want to remind everybody that your vet is there for you. A great vet is always going to be willing to get on the phone and talk with their clients. It happens on a daily basis within clinics. They're used to it. Leave a message with the receptionist. Just say, hey, I got a quick question. Can the vet please call me back? And they will. And if they have a quick answer for you, then they might have somebody else return the call. But I promise you guys, it's part of the daily practice at vet clinics to return calls. And if they think that, you know, it's something that they can't address over the phone, they very well may say, hey, I think a vet visit is warranted here and this is why. Or they might give you a simpler answer and say, hey, sure, you can come by and we'll refill that script. Or I'm calling in something to a human pharmacy for you. Or you can go to the drugstore and get this, and this is how much you should give. Because I'm just telling you guys that this should be the first thing that you want to do anytime that you're worried about something with your animal. I just want to encourage everybody to keep this at the forefront of your mind, that your veterinarian should be at the top of the list, and other things like we talked about should be at the very bottom. I can understand that if it's the middle of the night on a weekend and you cannot call your veterinarian, you might be tempted to get online and look at things or ask other people that might have similar situations as you. But please be careful and be aware that if you're going to do that, either to save money or because you're outside of business hours and don't want to go to an emergency clinic, please be aware of what types of things can go wrong in situations like that. Dosing problems, drug interactions, and just making a mistake of treating the wrong thing entirely. I would love for you guys to keep this in mind. Make sure that you have an established relationship with a veterinarian so that you can always call them when things arise. Please be cautious as you care for your animals. Please let us know if you have any questions or comments on this subject. And if you didn't join already, we do invite you to join our exclusive Better Pet Parents group that we just made, because that's a place that we all get together for moral support. So along with today's topic, no, we do not diagnose within that group. but we do try to share useful information about how we can all be better pet parents. So we invite you to join that if you haven't already, and we look forward to seeing you guys there. Thank you for being with us, and we'll see you next time.